Good evening, and thank you for keeping it TV 47 and of course Body Garage, where your health matters. My name is Sheila Chelangat, and on this episode we are focusing on kidney stones. What causes it? What are the symptoms and how can someone prevent it? Of course, you can chime in our feedback via our SMS line and tell us what you would want the doctor on set tonight to answer you in this particular topic. And of course, I am joined by Dr. Patrick Muigai, who is a urologist.
Urologist.
Yes. Good evening, Dr.
Good evening, Sheila. How are you?
I'm good. I'm actually glad sijasema uриnologist. All right. I'd like us to start with the ones and twos. Could you just tell us what is the kidney? I know everyone knows what the kidney is, but what role does it play in a human's health?
All right. Now, thank you for having me here. My name is Muigai, not Muigai.
Oh, Muigai.
Muigai Mararo, urologist. Even before you go to the kidney, first of all, I should tell you who is a urologist, so that next time you don't mispronounce it.
Yes.
So number one, a urologist is a doctor, right? Number two, a urologist is a surgeon, but is a surgeon who only deals with the urinary system.
Okay.
So our work is very simple. We make sure water is flowing, urine is flowing. So we are the human plumbers. We make sure water is flowing. So any issue that is affecting the urinary system, we sort it. From the kidney, to the ureter, to the bladder, to the prostate. And a urologist is not the male version of a gynecologist. We treat both male and women, both male and female. So, the kidney. So number one, every person has two kidneys, right? But there are people who are born with one.
Oh, okay.
And they survive. They actually don't know it until probably in adulthood, and they have gone for a routine scan, for example, because it's a lady and she's pregnant and she's told, oh, you have one kidney. And they're like, oh, all right. You can survive
On one kidney.
on one kidney. There are people who have that, and it is congenital. It's something you're born with. Okay, so don't go and say someone stole my kidney. Okay, you are born with one kidney. So the kidneys are usually on the side, just below the ribs, here on the side. So there are people who come to the clinic and tell me, you know, Daktari, my kidney is paining, and they tell me my kidney here is paining. No, the kidney is actually not here. The kidneys are usually just below the ribs. Actually, the last two ribs cover your kidneys.
Oh.
The kidney is actually below. Okay, there's some ribs. The last rib covers the upper part of the kidney. So it is important for people to know that, so that they know where is this pain coming from. So you have one on the right, you have one on the left. The kidney on the right is usually lower than the one on the left, because the liver on the right usually presses the kidney downward. So they are not equidistant, they are not at the same level.
Okay.
Again, that is important for people to understand. There are people whose kidneys are not positioned here. There are people who have something called a pelvic kidney. So you might have one kidney here and another one here, just above the bladder.
Okay.
It's called a pelvic kidney. Again, that's a congenital anomaly. And that kidney usually works perfectly, and we don't do anything about it, because God doesn't make mistakes. So you put it there and it is working, you leave it. All right? So what is the work of these kidneys that you have? So most people think the kidney only has one role, which is filtering waste. But the kidney actually has many roles in the body. Of course, the most important one is filtration. Okay? It filters waste from the bloodstream, and then it comes out as urine. That's number one. But number two is that the kidney maintains blood pressure. Your blood pressure is controlled and maintained by the kidney. The one that decides, now we are going to absorb more water because your pressure is going down, right? It's the one that decides we are going to release more water because your pressure is going high. And that's why you find most people with hypertension, their kidneys are not working, and vice versa. So that's rule number two. Rule number three of the kidney, it produces something called hormones. And the most important one is called erythropoietin. I'm not sure whether I'm supposed to talk in that big language
it's
here.
Very big. Yeah, it's okay. You can make
right.
Break it down.
All right. So erythropoietin is a hormone, it's a substance that is produced by the kidney, and it helps in making your blood. Okay? Again, most people who have chronic kidney failure, they will tell you that they usually get some injections for erythropoietin because the kidney is not producing that.
Okay.
And their blood need to be produced.
All
so
right.
that's the work of that erythropoietin. So it's just a substance that is produced by the kidney. Very important.
Very important.
Number 4, the kidney has another role of activating vitamin D. See, people go and say, just take this kid to the sun, he needs vitamin D. Vitamin D does not start from this, it actually starts there from the skin, but for it to be functional in the body, it is activated in the kidney. For you to have an active vitamin D, it goes through many processes, from the sunlight, through the skin, it goes to the liver, and finally, the kidney has to activate or convert it to an active molecule.
Okay.
So that is, the vitamin D is a function of the kidney. So the kidney is not just urine, it has a lot of work.
It has a lot of work.
It has a lot of work. Yes.
And so tonight we are discussing kidney stones. And in the US, you know, over 1 in 10 women do actually get kidney stones, and 1 in 14 men do get kidney stones.
Yes.
I don't know how common is it in Kenya, and what is it even?
All right. So kidney stones, let's first of all start with, before we even go to numbers, why are we interested in talking about a kidney stones? Because number 1, kidney stone is a health burden. That's number 1. And it is affecting so many people. We don't have the numbers locally, like we can quote this in this. We don't have those numbers here, but we are working on them. There are ongoing studies about that, and we'll probably give you data next time when we come. But most importantly is, why kidney stones? Sheila, I have several patients who are on dialysis because they developed kidney stones.
Okay.
Okay? Because the kidney stone, what it did, it went and damaged the kidney. There are people we have removed kidneys because of kidney stones. There are people who are on dialysis because of kidney stones. There are people who have gone to ICU because of kidney stones. Because what kidney stone does is that, number 1, it is going to block your urine flow. That's number 1. And once it blocks the urine flow, what will happen is that it is going to destroy the cells of the kidney that does the work of the kidney, the filtration, and all the other function. So you end up in dialysis. Number 2, if it blocks that urine, it can become infected, and you end up with something called sepsis. So in medical term, we call it urosepsis. That will take you to an ICU. And I know people who have actually died because of urosepsis from a kidney stone. Okay, so that's the main reason, because it directly impacts on the kidney. Because number 3 is that if you get a kidney stone, it is probably the worst pain you'll ever feel.
Okay.
The worst pain I've seen a man come to the hospital with is a kidney stone. So most of the time you can tell if someone has not been in an accident and is coming there writhing in pain, it's probably a kidney stone.
It's probably a kidney stone.
Yes.
And you know, we're talking about stones. How big are these stones, and what even causes these stones?
Okay, good question. So now, kidney stones usually start as crystals, very tiny crystals. See, what happens is, for your body to produce urine, it has to filter some waste, right? Some of that waste that is filtered is salt, okay, which is filtered in very minute crystals. Now, if you don't take enough water, it means the kidneys are going to absorb a lot of it, and then what will be filtered will actually be more crystals. Okay. And then with time, these crystals can aggregate. They grow, they become bigger and bigger, and they become a kidney stone. So size can be very tiny, small. They can grow to occupy the whole kidney. Yes. Yes. So that is basically how those kidney stones form. They form. Just imagine if you go to the coast and take that salt water, put it on a basin, and then the water evaporates. Whatever remains is some to small crystals.
Yes.
Now aggregate those crystals, add them up. They form actually a big stone. Yes.
Okay. So you've said, if I'm getting you right, sometimes it's because you do not get to drink enough water.
That is one of the causes. Yes.
Is there another cause?
Yes. So the commonest cause of kidney stone is actually dehydration. And that goes to tell you most of the people we find with kidney stones are either people who live in very hot places. So we usually have a high stone burden at the coast, and we have a high stone burden in Kenya in northeastern. Again, there's only one thing common with those. They are hot. They are hot. Northeastern is very hot, coast is hot and humid. So those guys tend to sweat a lot and probably not hydrate as much. So that's why you find stones are more common in those two belts. Of course, there are other people who get a lot of stones, people who work in kitchens, mechanics who are always under the cars, hot areas. So again, the bottom line is one thing. It's hot and they are not hydrated as much. So that's why we find them, especially within that cohort or that demographic. But the other causes of kidney stones, obesity is another one. So people who are obese tend to get a lot of kidney stones. The other causes of kidney stones is medicine. There are drugs that people take and they actually predispose them to kidney stones. There are people who take supplements, like Sheila will decide, I think I need vitamin D supplements, or maybe I should take calcium or this vitamin C. You remember during COVID, how people took those vitamin C supplements? We are seeing them now because of kidney stones. So these supplements people take over the counter without prescription by the doctor. They actually sometimes do more harm than good. So all those vitamin C, calcium, sodium containing supplements, most of the time they're actually not helping, because who told you your body does not have enough calcium? Who told you that you need that vitamin C? Did you measure, did you have it checked? And you are told you actually have deficiency of vitamin C. Or you are like, this is a trend. This is a trend. Let me do this, you know? Yeah, so medication, all right? High protein diet. Okay? There are people who, watu wa kanyama choma, those guys.
Yes.
Very high protein diet increases your risk of getting kidney stones. High salt diet should probably have come as number 2 after dehydration. High salt diet. You know, these guys who are like, let me just sprinkle, let me just add another salt. You go for nyama choma, and even before you have tasted it,
you've already
add salt. But don't worry, we'll be here waiting for you. And we shall be here. Yes.
Okay, and then, you know, before you even go on, you mentioned that dehydration is the first cause. But then how do you know you're dehydrated? Because let's say in a day I've taken my glass of water and I don't feel like taking more water. What tells me that I am dehydrated?
Good. So the ultimate measure of knowing that you're actually taking enough water is you check your urine. So your urine should be clear all the time. See? Like this. Let me just take this water because I don't want to get a kidney stone.
And of course, you at home do take your water.
So the ultimate test is actually you check your urine. Your urine should be clear.
Clear like the water?
Yes. Should be able to see the other side of the urine. If your urine is colored or has changed color, you cannot see the other side, then you have not taken enough water. Because I can come here and tell you take 8 glasses of water. But that cannot be true for everyone, because someone in Northeastern and someone in Nyeri, that 8 glasses of water will not be the same. Because the guy in Northeastern is sweating more, is losing more. The guy in Nyeri is not losing as much. So that cannot be standard. The only standard way is check your urine. Then you will know, am I hydrating enough or not? If you are constantly, your urine is yellow, is colored, then you are probably my customer sometime in the future.
Okay, Daktari, and with that, we are up for our first commercial break. We have learned, you know, the causes of these kidney stones, and I hope you're back there at home just, you know, checking and ensuring that have you taken enough water today. So do not go too far. We will be back with so much more. Keep it TV 47. All right, thank you very much for keeping it TV47. And of course, this is Body Garage, and we are delving into kidney stones. And with me is Dr. Patrick, who is a urologist. Once again, Daktari, karibu sana. And now we have dealt with the causes.
Yes.
Are there different types of kidney stones, and from how severe is one to the other?
Oh, all right. So there are about 5 types of kidney stones. Okay. But the commonest stone, about 75% of stones, they're called calcium stones. They're called calcium oxalates. Right? They are formed by a combination of calcium and another mineral called an oxalate. So they're called calcium oxalate stones. That's the commonest. The other type of stone is called calcium phosphate. The other types that are usually brought about by if you get recurrent infections, again, that is something we should have mentioned. If you get recurrent urinary tract infections, recurrent infections of the kidney, you can actually get some type of stone. We call it struvite stones. There are other type of stone called urate or uric acid stones. And then there are others called cystine stones. Again, those are very many details because by the end of the day, bottom line, what the patient want to know is, they have a stone? Yes.
Yes.
Can we get it out? Yes. How are we going to prevent it? But what we usually do is that if we get a stone, we usually take it to the lab for something called a stone analysis. Then they tell us what is causing it. But I can tell you, all the time I've operated patients and we've taken stone for stone analysis, all of them have come back as calcium oxalate stones. Then those are the commonest kind of stones.
Commonest. And when you look at between either men and women, which one is more common in men, which is more common in women?
They don't have gender inequality. Yes. Calcium stone is common to
everybody.
Everybody, yes. The others are usually, if you have, for example, cystine stones, they're either caused by some medication or you have some congenital anomalies. If you get struvite stones, then most likely you're having some recurrent infections. Again, those are not the commonest of the things. If you get uric acid stones, it probably means your urine has been very much acidic and you're probably having other conditions. Yeah, so generally, commonest stones are calcium stones.
And then what about the age groups? A child who is more prone to get it?
See, stones get everyone. Even children, they can get stone.
Even a newborn?
Not a newborn. Okay. Yes, as long as the risk factors abound. So you'll find stones at the coast in children, but they're not as common in children because, again, stones develop slowly over time. Yes. So that's why you will find more stones in adults that you'll find in kids. So I've found very few children with stones here in Nairobi. You go to the coast, there are many. The number grows. You go to Northeastern, the number grows. But they are common in adults.
Yes. All right. So then now my next line of question would be, now what are the symptoms? What should I look out for?
Okay. So like I mentioned earlier, one of the most severe pain I've ever seen someone with, apart from trauma, I mean, like, it's not a fracture or something, is actually a kidney stone. It causes severe pain, okay, here on the side. So you call it a flank pain. So it will cause a flank pain that is very severe pain that usually, when it comes and goes, okay? So we say it is intermittent. It will come at the flank, very severe pain. It tends to radiate, okay? So it can go to the groin here, especially if it is on the ureter. Now, I should have probably told the viewer that once the urine is made in the kidney, there is a tube that carries that urine down here. It's called the ureter. And then it goes to the bladder before it comes out with the urethra. So most of the time when you're talking about kidney stone, you're talking about a stone that is either in the kidney or in the ureter, because those are the most significant stones. There are other places you can get a stone. You can get a stone in the bladder, or you can get a stone even in the urethra. Okay. So depending on where the stone is, most of the time people come to the hospital because the stone is in the ureter. It causes a lot of pain here.
Okay.
That pain tends to go to the groin. It can also go to the back. Sometimes the stone can stay in the kidney and grow very big. So these guys will not have that acute pain. They will have chronic there'll be just some dull pain that will be lingering here, and then it goes to the back. So sometimes they will just come with, I have a back pain here, and I have a pain here that goes to the back. Dull pain that just lingers there, doesn't go anywhere. But the pain of the stone that is stuck in the ureter is acute, very severe pain. That's number one, is usually pain. And that's what brings most people to the hospital. Number two is you will get nausea. When you get this pain, you have nausea and vomiting. Number three, you might have fever because it is blocking the urine here, and that urine can become infected. So you'll have a fever. Number three, you might have blood in urine. We call that hematuria. So you might have some drops of blood in the urine when you get a kidney stone. Those are in acute setting. There are guys who come because they have recurrent urinary tract infection. One cause of recurrent UTI is actually a stone, especially for men or even for ladies who have recurrent urinary tract infection and everything has been checked. The next thing, when now they are referred to urologists, that will probably do a scan, and you will probably see there's a stone stuck somewhere, and that stone usually encloses a bacteria, so antibiotics cannot reach there. So you get that recurrent urinary tract infection. So by and large, those are the symptoms of urinary tract infection. But of course, there are other guys who come when the disease is late progressed, and they will come with sepsis. And these are the guys who can even end up in HDU or ICU. There are people who come with huge stones that are blocking on both sides. In fact, a few weeks ago, there's a patient who was flown in from Somalia, and he came in very sick because he had stones on both sides, both ureters, both blocking urine. So that is a real emergency because it's just a matter of days and you lose both of those kidneys.
But I thought it's only one kidney that normally functions. So how is it that both would have the stones?
No, see, you can have stones on both sides, okay? Actually, I found many people who come, once you get a stone the first time, your risk of getting another stone is actually much higher. A repeat stone is actually much higher. And you can have stones on both sides. But if you have stones on both sides that are blocking urine flow on both sides, that is an emergency. Because you can easily lose those kidneys because of blockage on both sides. When you come with a stone on one side or on both sides, we decide which side we are going to operate first before the other one. Yes.
Okay.
So those are majorly the symptoms of a kidney stone.
Of a kidney stone.
Yes.
All right. So once someone now is, getting this pain, what are some of the options of treatment? Is it always removal?
Okay. So before we even go to treatment, then we have to actually figure out, do you actually have a stone or not? So we have to investigate you. And what happens is, once you come with this stone, with these symptoms, because you'll not come with a stone, you'll come with the symptoms.
The symptoms, yes.
The first thing that will take you to the hospital is those symptoms. However, most people who come to me, they will already have been investigated because most of them will be referred now to a urologist. But once you go to the hospital, what will be done is you will have some tests done. One of them is a urinalysis will be done. And what it will show most of the time is some traces of blood or even some infection. We'll have a scan done. Most of the time, an ultrasound is usually done. And it can show a stone if it is in the kidney, but if it is in the ureter, it will not show it. However, it can show the blockage of urine and backflow of urine back to the kidney. The test of choice that we do is something called a CT scan. We always have to do a CT scan because that CT scan will tell us, number one, how big is the stone? Number two, where is that stone located? Number three, how many stones? There are people you do a CT scan and you find they actually have 5 stones on one kidney and probably 7 on the other kidney. And by the way, those are not figures that I've just made up. It's something that we actually commonly see. So that CT scan will tell us so many things. It will tell us where is the stone, how many stones are there on both sides, what's the size of that stone. And it will also tell us what's the anatomy of the kidney. Because sometimes you might have a stone, but your kidney is actually in the pelvis. So it tells us all that. So usually that is a key imaging that we always have to do before we decide what are the options of management. The other test that we'll do, of course, we'll check your kidney, we'll do blood and check your kidney how good are your kidneys functioning. We'll check your blood whether it has an infection. Are you fit for surgery? There are other tests now that we do to see what is the source of your stone, or what is the component. So you can take blood and do something called calcium, magnesium, phosphate. There are other tests now that we add, auxiliary test, when we are testing for that. Yes.
Okay. So then after you've tested now, I'm sure you're moving to treatment.
Yes.
So how do you treat now the kidney stone?
So now, stones are treated. There are usually two main ways. Either it is non-surgical or it is surgical management. So depending on the size and the location of the stone, we'll decide, can we give you medicine or do we intervene surgically? So if you have a small stone and it is not causing an obstruction, we can give you medicine for 2 weeks. These medicine are not to dissolve the stones. These stones, you cannot dissolve them with medicine. They are not for dissolving. It is to help that stone come out. See, the body does not like foreign objects, and the stone is a foreign body inside that kidney. So what happens is that kidney will start pushing that stone out, and even the ureter will start contracting and try and push that stone out. So depending on where it is, if it is very nearer to the bladder and it is small and it is not causing any obstruction, we can give you medication.
Okay.
Then we see you in 2 weeks, and then if the pain has not recurred after 2 weeks, we do a CT scan and see. So that's one way, non-medical management. But I'll tell you, most people who come to the hospital because of symptoms will not end up with a non-medical management, because by the time that stone is causing pain, it is obstructed somewhere. So it's unlikely to come out. So then we intervene depending on the location and the size of that stone. Those are two main things that we usually do. And intervention is usually surgical. The commonest procedure that we do is called a laser lithotripsy. Now, laser lithotripsy is an endoscopic procedure. Endoscopic means we're using a camera. So we put a small camera through the urethra. Urethra is now where the urine comes out. That camera will go to the bladder. It will direct it to the ureter up to where the stone is. So you'll find the stone either in the ureter or in the kidney. And then there is usually another fiber called a laser fiber that we usually put inside that camera. And once it touches the stone, we activate the laser machine. It is going to transmit energy that is going to convert that stone to dust. Basically, it breaks it down, and then we wash it out.
Okay.
Okay? So that's one way, commonest procedure. If you ask any urologist here in Kenya, probably 99% of all patients who come with stone end up having a laser procedure done. There are other procedures that we do. The other one is called a PCNL. PCNL basically means we usually put a scope on the side here. We put a fiber, or basically like a small catheter there, but it is a telescope. We're able to see the stone, and then we break it down. Okay, there is a machine that breaks it down. Okay, manually. So it can be manually, or it can be again using a laser machine. We break it down. So those are the two commonest methods that are done. If the stone is too big, we can remove with open surgery. Again, very rarely will you find any urologist opening patient because of a stone. Or you can do laparoscopy. Laparoscopy means we put some cameras inside the body, we see where the stone is, and we remove it.
And you remove it.
Yes. So those are the options all those options are available. Yes.
Okay, but then the last question that I'd have is, can a stone lead to entire removal of a kidney?
Yes. Yes. What happens is you can actually have a stone that has stayed in the kidney, and the whole kidney has actually become a stone. Okay? Or it has blocked urine for long, and that kidney is no longer functional.
Okay.
Yes. So at that point, we actually don't go to remove the stone. We actually go and remove the whole kidney with its stone. Yes. Because that kidney is not functional, and it is actually a risk to you because it is a bag of urine in itself.
Okay.
And it will keep giving you pain and infections.
Infections.
Yes. So yes, the stone can actually lead you to lose your kidney in its entirety. Yes.
All right, Daktari, we are up for our second commercial break. When we will be back, we will now get to hear from Daktari on how we can prevent this kidney stone. So do not go too far. Keep it TV47. All right, welcome back. This is TV47 and of course Body Garage, where today we are focusing on kidney stones. And just before the break, we have, understood from the doctor how these kidney stones can be treated. But then now, Doc, someone is probably wondering, how can I prevent it before it gets to that point where I need treatment? Good.
So, most important thing is water. Okay, simple thing that we usually underrate. So take enough water. And I said the only way you will know you are taking enough water is check your urine. If it is clear, then continue there at that point, okay? Shikilia hapo. Yes. Continue there. If your urine has changed color, then you're not taking enough water. So the surest way of preventing stone is water intake. That's number one. If you're obese, then you'll need to cut weight. So you need to hit the gym and change your diet. Number three is there are foods that we can do. There are things that we can do to prevent getting stones, especially in terms of diet. One of them is reduce high protein diet. Okay, drink a lot of water. People who have calcium stones, we want them to avoid food that have a lot of calcium and oxalate. You remember I told you the commonest stone is called a calcium oxalate. So there are fruits or foods that we do that has a combination, either a lot of calcium or a lot of oxalate. And some of them, but these are mainly for people who have calcium oxalate stones, is you want to avoid very green leafy vegetables, things like beetroots. Those have a lot of they have a lot of oxalate. On the other side of calcium, we want to avoid things like oranges, okay, that have a lot of calcium. But this is not for everyone. These are for people who, these are things we tell people that we have actually diagnosed them with calcium oxalate stones. Once you get a stone, you have a 50% chance that you'll get another stone in the next 10 years, 5 to 10 years, you'll get another stone. So it is absolutely important that you follow the doctor's advice for you to not get those stones. Avoid getting over-the-counter medication because you feel like I need medication that especially have a lot of sodium, calcium, vitamin C, vitamin D supplements. You don't need them unless you have actually been told that you need them. And most people who actually need those medications, Sheila, are people whose kidneys have failed. Yes.
Okay.
So if your kidney is functioning okay, those medications are fine. Yes.
Okay. Yes. And I've heard you mention that there are some foods that you tell someone to avoid. Says the greeny leafy vegetables.
Very green leafy vegetables.
So what
like
then
spinach.
are the options for these people who have this stones?
So you see, these green leafy vegetables there are many other options for vegetables, like cabbage. Actually, no, it does not have as much oxalate as spinach, for example. Yes. So you have other options for your vegetables. Okay.
Yes. And for a person like me, probably or someone who doesn't have the kidney stones yet, are there? Could you name for us the types of food that they should at least avoid that might cause kidney stones?
Okay. Number one, I'm sure you love nyama choma.
Yes, a lot.
Yes, so you're probably going to reduce your intake of nyama choma, and while at it, you need to reduce adding salt to that nyama choma. That is absolutely important. And not just nyama choma, the salt. A lot of salt in food is very harmful to your body, right? Both for the kidney and both for your stone formation. So salt in moderation. I think I cannot overemphasize that. The more salt you take, the more risk you are of getting a kidney stone or even getting hypertension, right? So, and most doctors will tell you that, especially if you're dealing with hypertension and kidney stones. So avoid what? Avoid salt, all right? Adding salt, a lot of salt in food. Drink a lot of water. I think those are the two most important things I want to emphasize here.
Drinking water.
Water and salt. Yes. You do those two, you probably have avoided stones in a big way.
In a big way.
Yes.
You've mentioned that there are chances of the stones recurring.
Yes.
So for a person who has already undergone medication and surgery, what then should they do to avoid this recurring?
Good. So now that's a very important question, because it is usually important for us and for the patient as well that we are able to get a stone analysis so that we know what type of stone that you are having. Because if you're having a strovite stone, for example, you remember I told you that there's a kind of stone called strovite. It means you're getting recurrent urinary tract infection. Then we need to prevent that. If you're getting a calcium oxalate stone, then we know you need to take a lot of water, you need to reduce salt in diet, you need to avoid the green leafy vegetables, you need to avoid things like beetroots, you need to reduce high protein diet, animal protein diet, and you need to avoid those supplements. And you need to make sure that your medication are actually prescribed by the doctor, so that you don't have a lot of medications that have a lot of sodium, calcium, and other medications that can predispose you to getting kidney stones. So these are guys that we need to follow them up regularly. Yes.
Okay. And we are talking about the kidney stones. You said there's one who might get strovite, and then the other one has calcium. Is there a chance that if I had strovite and then it now recurs with a different type of stone?
Yes. Yes, you can get a mixed picture of a stone. You can actually get a stone that has a calcium oxalate and has calcium phosphate. So you can get that. The fact that we have cleared the calcium stone does not mean you cannot get another type of a stone. Yes.
Okay.
So you can come back now with a strovite. Yes.
And Dr. one of the most frequently asked question is, can I feel this stone growing?
No, you can't.
Why is that?
Because you cannot even feel your kidney. Yes, and the stone is inside the kidney. And these stones, Sheila, are usually small. We are talking about a stone that is about 8 millimeter, or the biggest stone I've seen is probably 2 centimeters, 2-point-something centimeters. So it's actually very, very tiny kind of a stone. But once we go and put a camera there and we show you, it actually looks very, very big. But sometimes we go and see and get a stone and we actually remove it and we put it in a container and bring to the patient like, E2, this tiny, this small. Yes, because this ureter, this tube that carries urine here, is about 6 to 8 millimeters in diameter. So you can have a 6 millimeter stone or even a 5 millimeter stone that is giving you bothersome symptoms. Yes.
Okay. And could this kidney stones also be causes to other kidney diseases?
Yes. This kidney stone will, see, what will happen is, once you get this kidney, once you get this kidney stone, it causes backflow of urine. This urine puts pressure on the cells that filter the urine. They are called nephrons. So you start losing them one by one. And once you start losing those, remember I told you there are many other functions of the kidney, like controlling your blood pressure. Then you'll end up with hypertension. Yes. You can end up with infections of the kidney, something we call pyelonephritis. Okay, that will keep you in hospital. You can end up losing that kidney in its entirety. So yes, stones is a big burden. Yes.
Okay. And my producer is just asking, what about someone who just has a family history of people getting kidney stones? Does it mean that I should be on the lookout as well?
The producer must have read a good one, because that is something we actually forgot to mention. There are people who have a family history of stones, especially this type of stone I told you called sustained stones. Sometimes they tend to run in the family. Yes, so again, the type of stone matters a lot. But yes, if you have a family history of stones, there is a chance that you might also get stones. So again, you know those preventive measures that I've told you? Drink a lot of water, avoid salt, reduce your high intake of high animal proteins, all those things. Yes.
Okay. For someone who has not yet got the kidney stones, what are some of the tests that maybe when I go for checkup, I should request to get so that we start preventing this thing as early as now?
You can't. You see, these are not things you cannot just walk in and say, I want to check for kidney stones, okay? Because this is not cancer, right? You just need to make sure that your urine is good and your kidney is functioning okay. Okay, and that whenever you feel something in your body, it's your body telling you something is cooking.
It's cooking.
Yes. So don't ignore that pain. Whether it is a back pain, it's a flank pain, it's an abdominal pain, just don't ignore that pain. Have it checked. Yes. But we don't routinely screen people for kidney stones. No, it's not cancer. Yes. So I'm not going to tell you, Sheila, now go to the hospital and have your stones screened, your kidneys screened for kidney stones. It doesn't work like that.
It does not work like that.
Nope.
Okay, and in your years of expertise, what are some of the weirdest myths that you've come across on kidney stones in particular? Now,
there's something called gallbladder stones. So most people get, especially ladies, they will get gallbladder stones and they end up to a urologist. So that is I think that is one of the biggest things that I find people coming with, that I was told I have a stone, then they come to me. You can get stones in many parts of the body, all right? So it is important to know this stone is in which part of the body, okay? So that's one of the things that you can, that I've seen most people confusing stones with. Myths about stones.
Before you even think about other myths, what is the difference now clearly between a gallbladder stone and a kidney stone? Aren't they the same?
No, they're actually not the same. They are different. See, first of all, they're in different organs. Let's start from there. So the gallbladder is an organ just below the liver.
Yes.
Okay, and that is a specialty of someone else. Some people called hepatobiliary surgeons or general surgeons. Kidney stones are domain of urologists. So let's start from there. So they're in different organs. Number two, most of the stones in the kidney are calcium stones. Most of the stones in the gallbladder are actually cholesterol stones. So they actually can be given some medication to dissolve them, the one in the gallbladder, or they can have the gallbladder removed. Most of the stones in the gallbladder, if they're causing infection, you actually go and remove the whole gallbladder. We don't do that in the kidneys.
You do not do that.
Yes. So it is important to know which stone am I having. Yes.
Okay, and so now for someone who's on medication, what is your advice to them? How should they, structure themselves in terms of taking the medication? What should they look out for and what should they not do?
Medication for?
On kidney stones.
On kidney stones?
Yes.
So if we put you on medication, we have to follow you up. Obviously, because we need to know, did this stone come out or not? Usually within 2 weeks. It need to have come out. If it does not come out, then you have to come in and we repeat the CT scan. If the stone is still there, then you end up in theater. Yes. So most of the time what happens is that people disappear. You see, by the time this stone is causing pain, it is stuck somewhere. So once you come and we give you pain and we give you medicine and you go away, you think, that stone disappeared, it came out and you go. By the time you're coming back, you are losing your kidney. Yes. So it is also important for people to follow doctor's advice. Yes. So there is also a lot of people who are on Dr. Google.
Yes.
Yes. And hey, they will go and do Dr. Google, but then they come me for prescription. Then you ask them, so you did the Google thing.
Yes.
So you tell Google to prescribe for you as well. Nini tunasumbuana.
And it's very funny because everyone, before they even get to the doctor, they first have to start with Google.
Yes, and then Google tells them that they have cancer.
Yes,
and then they come running.
You're freaking out.
Yes, and then they come and tell me, but doc, you are sure I don't have cancer? Have you ruled out that I actually don't have cancer?
Yes. So last question. Is there just a possibility that this kidney stone would go away by itself?
Yes, it can pass. Yes, that's the only way it will go away.
That is the only way.
The only way is out.
Yeah.
Yes, no other way. It's not dissolving. No. So the only way of that kidney stone is out. And most people actually, they pass their stones naturally, normally, without even knowing that they have kidney stones.
Okay.
And they will actually never be diagnosed with kidney stones, but they have severally passed kidney stones.
Okay.
Yes. Some will come and tell you, hey, I was passing urine and I had something hit the ball. Yes. That was like a stone.
Is that loud?
Oh, yes. It's actually like a stone. It's like a sand. like a gravel of sand. So drop it on the bowl, it will make some noise.
Okay.
Yes.
And so someone is watching and is wondering, where can I find Daktari?
So if you need to see a urologist, not just for kidney stones, for, prostate, bladder, urine is not coming out, or it is coming out on its own, or many other conditions like erectile dysfunction, all those things that are managed by urologists. My office is in Upper Hill. It's a building called 40 Suite. It's next to Kenyatta National Hospital. Room number 8th floor, room number 9. It's called Mirazi. We're usually there every Monday morning and every Friday morning. I'm always there in the office. The rest of the days, I'm running up and down, doing surgeries and all that. Okay. But they can find me there.
All right. Yes. I hope that they would actually come and find you. Thank you so much for this session, Daktari. I have personally learned so much, especially on taking water and ensuring that every day you check on your urine, it must be clear. And I hope that you back at home also have heard Daktari and would take into consideration what he has advised. Thank you for watching Body Garage. It is a pleasure every Thursday to have you. And of course, do have yourselves a lovely night.